Welcome to Wisconsin Doctors. I'm Justin Riley, and today we're going to be talking about the rehab household of the Nursing and Rehabilitation Center here at Upland Hills Health in Dodgeville. And I'm joined first by Michelle Carver, who is the Nursing and Rehabilitation Center Director. Director, is that it?
Administrator.
Administrator. Well, welcome to the program, Michelle.
Thank you.
Awesome. So tell us a little bit about what you guys do here at the Nursing and Rehab Center.
Upland Hills Nursing and Rehab Center is a 44-bed facility. It was constructed in 2002 with the focus to create a home-like environment. So our facility is developed in households. We have 4 different households. Each household has 11 beds. 7 of those beds are private rooms, and then 4 are semi-private. Also, each household has its own kitchen, dining area, and living area to create that home-like environment for the residents. Also, 3 of the 4 of our households are dedicated toward long-term care, and then 1 household is dedicated for short-term rehab residents.
And that's kind of what we're focusing on a little bit today.
Yep.
And you have that home-like environment that I think is so important. You even call it a household. That's very cool. Very cool.
Michelle, can you explain the process of the admission process to get into the Nursing and Rehab Center to us?
Yeah, if you're a patient in the hospital following an illness or surgery and need a little extra rehab before you're able to transition home, the process would be the discharge planner at the hospital would make a referral to the Social Services Department at the Nursing and Rehab Center. At that point, we would take a look at your hospital stay, look at your medical record, to ensure that we could meet your needs at the Nursing and Rehab Center. We would look at your different medications, we'd look at our staff, we'd look at if we need any special equipment to meet your needs. At that point then, when the physician feels like you're ready to be discharged from the hospital, he or she would write orders then for your care to be transferred to the Nursing and Rehab Center. Also, if you have a scheduled surgery planned and feel that you may need some additional rehab therapy following your surgery, if you're having a hip replacement or knee replacement, then once you know the date of that surgery, you can contact the Social Services Department and get your name on the list for the rehab unit.
So if we have a loved one that is admitted to the Nursing and Rehab Center, how is that paid for? Is that something that insurance typically covers, or how does that work?
We are Medicare and Medicaid certified, and also we take several different insurances. Once the referral is made, though, we look into all of that on our end and then have that discussion with you or your family prior to admission.
Very cool. Good news.
And can you explain if there's any age restrictions that we go through?
Yeah, there is. In order to be admitted to the Nursing or Rehab Center, you have to be 18 years or older. And over the years, we have had the privilege to work with all ages in our rehab department. So.
And I'm sure that being the administrator of the facility, you've had an opportunity to see a lot of folks who've come in needing that rehab and then have come out obviously better than what they were before.
Exactly, and it's wonderful to see the progression of the residents and to hear how happy they are at the progression and that they're able to transition back home again.
Yeah, making that transition back home, that's so important. And they get to do it in a very home-like environment, like you mentioned before, and I think that's what makes what you guys do very, very special.
Yep,
so
very rewarding.
Yes. Well, Michelle Carver, thank you so much for joining us today. Don't go away. When we come back, we are still going to be talking about the rehab household here at the Nursing and Rehabilitation Center at Upland Hills Health in Dodgeville. There's more Wisconsin Doctors coming up right after this. Stick around. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and today we're talking about the rehab household for their Nursing and Rehabilitation Center, which is a very, very special place. And I'm joined now by Brenda Kite, who is a nurse for the Nursing and Rehabilitation Center. Brenda, welcome.
Thank you.
So describe to us some of the residents that you take care for in the rehab unit or the rehab household.
Yep. We have a wide variety of different people that come in for all different types of needs. It's very typical and common for us to have people come in after like a hip or knee replacement. They do rehab with us for a couple weeks and then return home again. Our nurses provide lots of different nursing skills. We do IV hydration, IV fluids, tube feedings. We do lots of different types of wound care. And then often we take care of people that are just deconditioned from illnesses such as pneumonia, COPD, CHF. They might be falling at home and they need to come in for a couple weeks maybe to get some strength again to return home.
COPD and CHF, can you describe to viewers what that means?
CHF is congestive heart failure,
okay.
And COPD is chronic obstructive pulmonary disease.
And when you say decondition, that's just kind of the lack of the movement, basically, that allows them to be healthy.
Or just general overall weakness.
Yes. Yep, absolutely.
Brenda, what makes Upland Hills Nursing and Rehab Center unique?
I think we're very unique. Not only do we have a beautiful building, but we provide resident-centered care, and that means that our residents are able to wake up in the morning when they want to. They have breakfast when they want. They tell us what time they would like to go to bed at night, when they want their shower or their bath. And the nurses work around their schedule to provide nursing services and medication administration. We are also lucky to be connected to the Upland Hills Health Hospital, which gives us easy access to things like lab, x-ray, ER, and multiple doctors and clinics. That's all right down the hall from us.
And I think that's really important for viewers to know that this is not a separate facility from the Upland Hills Hospital. This is right in the hospital.
Yes.
So you have access to all of that really great care that you would have, just by going to a hospital. So that's great. So talk to us a little bit about some of the nursing services that you guys provide in the Rehab Services Center.
Our nurses have a certified wound care nurse. We have an infection control team. We have a falls team that meets to talk about falls prevention for our residents and resident safety. We have a pain and behavior team that meets to address any residents that might be dealing with pain or that may be experiencing symptoms such as depression or anxiety. Our nursing team takes great pride in a team approach that we provide. Every day we meet with our social worker, our director of nursing, our administrator, our registered dietitian, our therapy team, and our activity department. And we talk about any resident concerns we might have or any goals that we need to be making or working towards to make the residents stay here a success.
So there's a lot of teamwork going on here.
Lots.
Yeah, very important.
What makes your job rewarding, Brenda?
I think my job is very rewarding by just seeing the different types of people that come into our building. We have so many different types of residents come in with so many different needs, and I think at the end of their stay, when the resident and the family and I are able to reflect back on their stay here and agree that yes, all of our goals were met, the stay here was a success for whatever reason they were here, that's what's most rewarding.
And seeing that transition that Michelle and I were kind of talking about earlier, that transition of what they look like or how they were when they went in, and then being able to transition back home again, which is, of course, is the ultimate goal.
Yes.
Yes, awesome. Well, Brenda Kite, nurse here at the Nursing and Rehabilitation Center, thank you so much for joining us today.
Thank you.
Don't go away. There is more Wisconsin Doctors coming up right after this at Upland Hills Health here in Dodgeville. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, Wisconsin, and today we're discussing the Rehab household here at Upland Hills, part of the Nursing and Rehabilitation Center. And I'm joined now by Chris-Ann Carls, who is the Rehabilitation Director and a Speech and Language Pathologist. Chris-Ann, welcome to the program.
Thank you.
So talk to viewers a little bit about your therapy team here and then your individual credentials and experience.
Okay. So our rehab team is comprised of a physical therapist and 2 physical therapy assistants, an occupational therapy and 2 occupational therapy assistants, and myself as a speech pathologist. I received my Master's of Science degree from UW-Whitewater in Communicative Disorders, and I've been a speech pathologist practicing for about 23 years now.
Very cool. Very cool.
What kind of diagnoses do you avail and treat as a speech therapist?
Sure. So as a speech pathologist, we look at 3 major areas. We look at communication, swallowing, and cognition. And in the communication area, we look at residents that have difficulty expressing themselves, understanding language, written language, and reading comprehension. With cognition, we look at residents that have difficulty with memory, problem solving, sequencing, and planning. And then with swallowing disorders, we look at individuals that are having swallowing problems that may possibly be aspirating when they're consuming either liquids and or solids due to weakness.
Wow, I never thought that swallowing would have been a part of speech pathology. That is so interesting. Wow.
Well, part of the reason it's part of speech pathology is we have expertise in the area of anatomy and physiology with speech. Those are the same areas that you use for swallowing as well. So
yeah, I imagine. I just never would have thought that.
Right.
That's really interesting.
With the various different types of people you see in diagnoses, you see how long will you keep them on therapy?
Well, it really depends on the patient. We really focus on individualized patient care. So it depends on, one, their diagnosis, two, the severity of their disorder, and also three, how much the patient can tolerate for therapy. We do offer speech therapy up to 6 days a week. Sometimes patients can tolerate 2 times a day, sometimes just 1 time a day. It depends on the patient.
So I imagine that it's different for every person who comes in, but what would you say are the main goals and objectives for people who are receiving speech therapy or regular speech therapy?
Sure. So for residents, we really want them on the communication end to be able to function as well as they can once they get back home. In other words, being able to express wants, needs, understand written language that may come in the form of their bills, understand medical terms and reports. As far as swallowing goes, we really want them to be able to tolerate a general diet by the time they go home. And they may need to work on some compensatory techniques before they go home as well. And then as well as on the cognitive area for goals, we'd really want them to be able to remember things like being able to remember appointments when they get home, especially doctor's appointments, and things that make them safe at home.
I'm just curious, what are the age ranges of people that you treat here? And you know, do you have a higher concentration of older, middle-aged, younger people? Can you talk to us a little bit about that?
Well, in general, you know, as Michelle had stated before, we can take anyone at the Nursing and Rehab Center from 18 and up.
Right.
In general, in speech pathology, we range anywhere maybe in the mid-50s and older. You know, we've had residents in their late 90s as well.
Yeah, it's interesting to me because I've, you know, when I think of speech therapy or speech pathology, I think of younger kids sometimes who maybe didn't develop, you know, in that area. But you're dealing with people who have, you know, maybe had experience and have had, you know, progressed normally, but for whatever reason now are not able to do that. So
Right. Very often we see patients that have had strokes, traumatic brain injury. We see patients with neurological disease like Parkinson's disease. And patients like Brenda had mentioned that have just general decondition that may be affecting their speech or swallowing.
yeah. Chris-Ann Carls, Rehabilitation Director and Speech and Language Pathologist, thank you so much for joining us today.
Thank you.
Don't go away, we've got more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and today we're talking about their fabulous rehab household here at the Nursing and Rehabilitation Center here at Upland Hills. And next, I'm going to be talking with Jennifer Benin, who is a physical therapist here. Jennifer, welcome to the program.
Thank you.
So talk to us a little bit, give viewers an idea of what your credentials and level of experience is.
I received my master's in physical therapy at UW-Madison, and I've been working in skilled nursing and rehab for about 15 years.
How long have you been here at Upland Hills?
I've been here for a little over a year.
Very good. You like it?
It's a nice place to work.
Good.
It's very nice.
Good. Awesome.
So what kind of diagnoses do physical therapists treat?
We treat a wide range of patients. We see everybody from debility or weakness to strokes and CVAs, but a big thing is orthopedics. So anybody who comes in for a knee replacement, hip replacement, have had a fracture, and have had surgery due to a fracture. ankle fractures, hip fractures, femur fractures, you know. We treat those patients, working primarily on strength, range of motion, getting them back to walking, working on their gait, doing gait training, so they're not walking with a limp, or and just getting them ready to go home.
And this is really, I think, what a lot of people think of when they think of rehabilitation. They think of that physical aspect. So that's a very, very important part for sure. Yeah.
So how long, Jennifer, and how often do you usually see orthopedic patients?
Our orthopedic patients, they can be seen up to twice a day for 6 days a week. It's very important to see them twice a day because they do tend to get stiff, and which can make them more painful. So we need to see them kind of morning sessions and afternoons just to get them loosened up and moving again. We individualize treatment to each patient and how they progress. We will keep them as long as they keep making progress until we feel that they're ready to go home and can transition safely to home. With some of the patients that we have that have had a fracture, a lot of times they come in with limited weight bearing, so we have to teach them how to transfer, get up out of a chair, or even walk with either having non-weight bearing, toe touch weight bearing, or like 50 pounds or 50% weight bearing on one leg. So, and so those patients we tend to keep a little bit longer because we kind of wait till they get full weight bearing. But otherwise, it's very patient dependent, you know, how they progress.
Yeah, and I noticed that you used the word teach a couple times, and you know, really, it seems to me like there's kind of two aspects. You know, you have folks that you kind of need to teach their brains how to work their bodies again, like if they've had a stroke or something, and then, but also there's that sort of muscle memory aspect of things where you need to sort of retrain the body on how to bear that weight, as you mentioned before.
Yeah, there's a big education component.
Yes, yes, it seems so. So overall, I mean, obviously we talked about education and things like that. What would you say are the main objectives of residents receiving physical therapy?
The main objective is, well, we base everything on what their goal is. Their goal is to go home and usually return to their prior level of independence. So we base everything in our treatment around that. So the biggest thing is to get them strong enough so that they can walk around in the community safely, whether they're using a cane, a walker, or without any device. Work on stairs. The stairs is a big thing. So we need to make sure that they're safe and independent with all that stuff before we can send them home, because the big goal is for them to go home and return to their prior level.
Right, absolutely. And you know, I'm curious, I mean, do you ever work with folks who maybe are able to, you know, live a certain level of independence at home, but are not able to exercise the way they used to? Is that patients, do you see patients like that at all?
Yes, and that's another education component. We have to, you know, we stress the importance to continue with the exercise, especially after a joint replacement, because if you stop moving it, you're going to lose that range of motion, and then you're going to have more problems down the road.
Absolutely.
So,
Jennifer Benin, physical therapist here at Upland Hills Health, thank you so much for joining us today.
Thank you.
Don't go away, we've got more Wisconsin Doctors coming up right after this. Stay tuned. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and we are talking about the rehab household from their Nursing and Rehabilitation Center. And I'm joined now by Trisha Brown, Occupational Therapist. Welcome, Trisha.
Thank you.
So talk to viewers a little bit about what your credentials and experience is.
I graduated from UW-Milwaukee with a master's in occupational science with a focus in occupational therapy. And then I also went on and had certification in lymphedema therapy, so I can work with people with swelling and different forms of edema within the entire body. So I've been working in a skilled nursing facility for 3 years now, with 2 of my last years here at Dodgeville.
Very cool.
So Trisha, how do your treatments differ from what physical therapy might be doing?
That's a great question.
Yeah, physical therapy and occupational therapy kind of go together a little bit to make sure that we focus on the whole body. Occupational therapy does a lot of work with the upper extremity to work on making sure the range of motion and strength is needed. Like Jennifer was saying earlier, how some people with orthopedic replacements have weight-bearing limitations. We have to work on making sure their strength in their arms is good enough to take that load off of the leg that might have the weight-bearing limitations. So a lot of times we'll work with those orthopedic patients to make sure they can do some strengthening, and then also our focus is on getting self-cares completed, making sure they can dress themselves, because a lot of the times hips or knees, they have the limited range of motion or they aren't allowed to bend a certain direction, so they'll have to use adaptive equipment to get dressed and use different things until they're able to bend those ways.
So it kind of sounds like that occupational aspect is basically like what their day-to-day lives are consisting of.
So yeah, so occupational isn't necessarily work-related, but your occupations of daily living.
Right.
So
yeah.
How often and how long do you expect to treat these patients in occupational therapy?
That's a good question, because everybody varies depending upon their level of severity. Sometimes strokes or different people with cardiac rehabilitation might need a longer period of time. Some orthopedics patients could take a little shorter period of time, but we usually see them once a day for 5 days or 6 days a week, and then either 2 to 3 weeks up to 3 months they could need therapy for occupational services.
Yeah, and so obviously some of the goals are to get them to be able to do those things that occupy their time at home, not just within their jobs, but talk to us about some of the broader goals of and objectives of having patients in occupational therapy.
Yeah, making sure that they can get home is the main focus, making sure that they can dress themselves, bathe themselves, go to the bathroom completely and care for themselves, cleaning themselves. And then we also work a lot on their home cares, cleaning, laundry, meal preparation, and what kind of adaptations or modifications we need to make in their home environment so they're safe. So we like to do a home safety assessment on patients to make sure that we can see how they're going to function in their home setting before they go home, so that we can prepare them for that. Even if it's medication management or finances and stuff like that, we want to make sure they can really be able to survive on their own back home again.
And overall, the goal of the rehab household is more, it's short-term care versus long-term care. We want to try to get, you guys want to try to get them literally back on their feet and then back home so that they can return to their previous quality or a better quality of life.
Exactly, yep. We want to make sure that they can function really well back at home. So however long they need to be with us.
Absolutely. Well, Trisha Brown, occupational therapist, thank you so much for joining us today. Thank you for the info.
Thank you.
I also want to thank my other guests, Jennifer Benin, Chris Ann Carls, and Brenda Kite, and Michelle Carver here at Upland Hills Health. This has been Wisconsin Doctors here at the Rehab household of the Nursing and Rehabilitation Center. And from all of us here at CW57 and Wisconsin Doctors, we're inviting you to live longer, live better. We'll see you next time.